The US has pulled the plug. Funding for HIV/AIDS projects in Africa gone, slashed. Over $60 billion in aid vanished. This isn't just a budget cut, it's a death sentence for millions. The impact, immediate and devastating. Clinics are shutting down. Life-saving drugs are becoming scarce. Health workers are losing their jobs, leaving communities vulnerable. This reckless decision will have ripple effects across the continent. The progress made in the fight against HIV/AIDS, now hanging by a thread, the world is silent. But the cries of the most vulnerable, orphans, pregnant women, the LGBT+ community, are deafening. Will anyone listen? Africa is staring into the abyss. The US funding cuts have pushed the continent to the brink of an unprecedented health crisis. The numbers are staggering. Modeling predicts 500,000 more deaths in South Africa alone over the next decade. Think about that. 500,000 lives extinguished, and it's not just South Africa. Malawi, Zambia, Tanzania, Zimbabwe, all are bracing for the worst. The cuts affect everyone, from those living with HIV to those at risk. Pregnant women, once guaranteed life-saving treatment, now face an uncertain future. Children born with HIV may not get the care they desperately need. Behind the statistics are real people, real stories, real tragedies waiting to unfold. Take Amina, a young mother from Tanzania. She's HIV positive, but thanks to US-funded programs, her baby was born HIV-free. Now, with the cuts, Amina's access to medication is uncertain. Her baby's future, unknown. Amina's story is not unique. Thousands across Africa are facing the same heart-wrenching reality. The cuts have ripped away their lifeline, their hope for a healthy future. The impact extends beyond healthcare. Job losses are mounting. The Inova Health Institute alone has laid off over 2,800 staff. These aren't just numbers, they're people's livelihoods, their families' well-being. Section 4. South Africa, a harbinger of things to come. South Africa, once a beacon of hope in the fight against HIV/AIDS, now faces a bleak future. The country had made significant strides in reducing the prevalence of the virus, thanks to international aid and robust local initiatives. However, recent funding cuts have jeopardized these hard-won gains. The country has been hit hard by the funding cuts, with dire consequences. Clinics that once bustled with activity now stand empty, their doors closed to the very people who need them the most. The impact is particularly severe in rural areas where healthcare facilities are already scarce. Clinics are closing down, especially in rural areas like KwaZulu-Natal. These closures mean that people have to travel long distances to get the care they need, if they can get it at all. The lack of accessible healthcare is a ticking time bomb for these communities. People living with HIV are struggling to access treatment. The medications that once kept the virus at bay are now out of reach for many. This has led to a resurgence of the virus, undoing years of progress in a matter of months. The virus, once on the decline, threatens to resurge with a vengeance. The lack of treatment options is not just a health crisis, but a humanitarian one. The situation is dire, and the stakes couldn't be higher. These cuts are a disaster, says Dr. Mbali Makanza, a leading HIV/AIDS specialist in Johannesburg. She warns that the healthcare system is on the brink of collapse, and the most vulnerable populations will suffer the most. We're going back to the dark ages where people died because they couldn't get the help they needed. The progress made over the past decades is being undone, and the world is watching as a preventable crisis unfolds. South Africa's experience serves as a stark warning to the rest of the continent. If a country with relatively advanced healthcare infrastructure can be brought to its knees, what hope is there for nations with even fewer resources? The US funding cuts are not just a problem for Africa, they're a global health crisis in the making. The interconnectedness of our world means that a health crisis in one region can quickly become a global issue. It's imperative that the international community steps up to address this looming catastrophe. Section 5. The price of progress. Scientific breakthroughs in jeopardy. The funding cuts have far-reaching consequences, jeopardizing groundbreaking scientific research. Laboratories that were once bustling with activity now stand eerily silent. The vibrant energy of discovery has been replaced by an unsettling stillness. Clinical trials for new HIV vaccines and prevention drugs have been halted. These trials were the culmination of years of meticulous research and collaboration among scientists worldwide. The abrupt cessation has left many researchers in a state of despair. Years of progress, countless hours of research, all at risk. The equipment that once held the promise of new discoveries is now being packed away, gathering dust instead of data. The world was on the cusp of major breakthroughs in the fight against HIV/AIDS. Scientists were celebrating milestones, hopeful that a cure was within reach. The atmosphere was one of optimism and determination. Now that progress is under threat. The once busy labs are now deserted, and the hope that filled the air has been replaced by uncertainty and fear. This is a major setback, says Dr. Lindiwe McKay, a researcher involved in HIV vaccine trials in South Africa. Her voice trembles with emotion as she speaks about the impact of the funding cuts. We were so close to finding a vaccine, a cure. The disappointment is palpable among the researchers who have dedicated their lives to this cause. These cuts have shattered our hopes. The dreams of a world free from HIV/AIDS now seem more distant than ever. The consequences of halting this research are immeasurable. The potential lives saved, the suffering alleviated, all hang in the balance. Not only for Africa, but for the entire world. The ripple effects of these cuts will be felt globally, hindering progress in medical research and innovation. The search for an HIV cure must continue. Despite the setbacks, the scientific community remains resilient. They are determined to find new ways to fund and continue their vital work. The fight against HIV/AIDS is far from over, and the world is watching, hoping for a brighter future. Section 6, A Glimmer of Hope. Where do we go from here? The situation is dire, but not without hope. Across the continent, there are countless stories of resilience and determination. Community health workers are stepping up, educating their neighbors, and providing essential care. These unsung heroes are the backbone of the fight against HIV/AIDS. The global community must step up and fill the void left by the U.S. International cooperation is more crucial than ever. The United Nations, with its vast network and resources, can play a pivotal role in coordinating efforts and ensuring that aid reaches those who need it most. The EU, private organizations like the Bill and Melinda Gates Foundation, even individual nations, all have a role to play. These entities have the power, influence, and resources to make a significant impact. By working together, they can create a comprehensive strategy to combat the epidemic. South Africa's President Ramaphosa has pledged to address the funding gap, but he can't do it alone. His commitment is a beacon of hope, but it requires the support of both local and international partners to turn promises into reality. Nigeria has allocated $3.3 million for HIV treatment packs, a drop in the ocean compared to what's needed. This effort, while commendable, highlights the vast financial challenges that lie ahead. More funding and resources are essential to meet the growing demand for treatment and care. The world cannot stand idly by while millions face a death sentence. The cries for help are growing louder, and the urgency of the situation cannot be overstated. Every day that passes without action is a day that more lives are put at risk. The time for action is now. We must rally together, harness our collective strength, and make a concerted effort to end this crisis. The future of millions depends on the decisions we make today. Let's not wait until it's too late. Section 7, A Call to Action, Silence Equals Death. The U.S. funding cuts for HIV/AIDS projects in Africa are unconscionable and will have catastrophic consequences. We cannot let this stand. Contact your elected officials, donate to organizations working on the ground. Raise awareness on social media. Silence equals death. Let your voice be heard. Demand that world leaders take action to address this crisis. The future of millions of lives depends on it.